I'm Joyce O'Shaughnessy. I'm at Baylor University Medical Center, Texas Oncology, and U.S. Oncology in Dallas, Texas. The question of whether supplements are safe to take during particularly curative therapy with chemotherapy or endocrine therapy, anti-estrogen therapy, hormonal therapy, is a really important question. Again, one that I really do address essentially with every new patient I see who's just been diagnosed with breast cancer. We have some data that gives us concerns about combining supplements with our standard therapies. And so for that reason, I generally recommend that women hold supplements during chemotherapy, radiation therapy, and also during endocrine therapy. There's a lot of data we don't have. There may well be some supplements that are safe with our curative therapy, but we don't have all the data we would like. And so I'm very, very cautious. There are some emerging data to help us, and really, as I said, do tend to give us caution. There was a study many years ago published in the Journal of the National Cancer Institute, so a very high-level journal, where it was found that herbal supplements, such as St. John's wort, which is very well studied, do increase the liver clearance of a wide variety of chemotherapy agents. So they decrease the amount of chemotherapy that stays in the body because the liver just rapidly removes it, because the herbal supplements increase the liver metabolism of the supplement, and then that spills over and then increases the metabolism of the chemotherapy. So we know that many of the herbal supplements can do that. And so we really are very cautious during chemotherapy. Many of the herbal supplements can actually be seen as weak plant estrogens in our body, such as red clover, such as ginkgo biloba, or ginseng, for example, among many others, and many we don't know. And we know that if you add a weak estrogen to, for example, our aromatase inhibitors, anastrozole, letrozole, exemestane, are anti-estrogen therapies that we use all the time in the curative setting, we know that weak estrogens can inhibit the full benefit, decrease the benefit of our aromatase inhibitors. We know that because in a large clinical trial done many years ago, tamoxifen, which itself is a weak estrogenic compound in postmenopausal women, tamoxifen detracted from the effectiveness of anastrozole, our aromatase inhibitor. So giving the aromatase inhibitor alone was more effective than giving it with tamoxifen. So we want to be very careful about introducing weak plant estrogens when we're utilizing aromatase inhibitors. So we're just very cautious. Very recently, there was an important paper published in the Journal of Clinical Oncology, our highest reputable oncology journal, looking at the outcome of patients with early breast cancer who were receiving standard adjuvant chemotherapy. And they looked at a variety of supplements in patients who were taking the supplements, patients who were not taking the supplements, to see what the outcome was from their breast cancer. And of course, they did balance out other factors that could also impact outcomes, such as nodal status, what kind of chemotherapy, etc. And what they found was concerning. A number of the supplements did decrease the effectiveness and decreased the outcome, worsened the outcome of patients with early breast cancer. The antioxidants in particular, CoQ10, vitamin C, vitamin E, were all problematic in terms of decreasing the effectiveness of chemotherapy. Vitamin B12 was not safe. Folic acid was not safe. Vitamin D was safe. and a multivitamin was safe. I personally would probably avoid the multivitamin because some of them have a greater amount of antioxidants in them than others. So my bottom line from that trial was the only thing that I felt was safe was vitamin D. So that's recent information that I do share with my patients. So I think it's just prudent to not take supplements, whether they be herbal supplements or whether they be vitamin-based supplements, antioxidants-based supplements during chemotherapy, certainly. And I think largely because of the unknown, I would also be cautious and not take them during endocrine therapy as well. Unless, of course, a woman has a deficit, for example, in B12, and she needs a B12 supplement to get her levels up to normal. That's a different matter. And I do think a regular multivitamin that's not high on any one of the vitamins or any of the antioxidants is also reasonable along with endocrine therapy.